If your gums stop bleeding, does that mean that the periodontal disease or the gum disease is cured? Not necessarily. So bleeding is a sign of inflammation, so it's actually good news. That just means that if we do stop the bleeding, we are headed definitely in the right direction. However, bleeding is because the tissue becomes inflamed, and that is based on the concentration of the bad bacteria that is present in the tissue. So just because the concentration isn't high doesn't mean that you don't have them there. So what we want to do is monitor these bacteria in the long term. And the way we do that is based on a 3-month recall, visiting the hygienist in our office for bacteria control appointments. And then when needed, we will actually do a salivary test and send it to a lab. And then the lab takes the DNA of the bacteria that was present in the saliva and will break it down into the species of bacteria and also the concentration. As a matter of fact, the lab will also tell us whether that bacteria is in a concentration which is high enough in that it would require or benefit from an antibiotic treatment. Not just any antibiotic, but the lab will actually tell us what antibiotic or combination of antibiotics would target that specific species of bacteria. So there are so many different things to do, but monitoring is basically everything. Because even though there's going to be bacteria there, the damage really starts to take place when the concentrations go up really high.